Hey YouTube, this is Sunny Rain 247, and today is November 1st, 2010, and it's a little over 11 weeks and a couple days since my post-op lap band surgery. And I just wanted to come give you a quick update, tell you how I'm doing, give you the numbers. I always like to start with the numbers because that's what we care about, right? Okay, for the numbers. I am 169.2, and I started out on the day of surgery at 200, so that means that I am now down 30.8 pounds. My highest weight around the time of orientation and going to class and getting all the tests done was 205. That's not the highest weight I've ever been, but around that time was 205. I only had to do a one-day liquid diet. I didn't have to do a 2-week thing because my BMI was pretty close. So I'm 5'2", and because of that, I didn't have to do a 2-week diet. I just had to do one day. So I was 200 on the day of surgery, and I'm now 169.2. So that's going good, along with watching what I eat, exercise 2 or 3 days a week, sometimes 4, but not consistently, so I'll definitely have to do better with exercise. Still find excuses not to go. Haven't downloaded any C to 5K, Couch to 5K stuff yet. That's a goal of mine in the future, but I haven't met that goal yet. Found out I'm not eating enough protein. Found out from the dietitian that I'm not eating enough protein, so I had to put protein shakes back into my diet. And particularly I'm not, because I've had 3 fills. My last fill was last week, and anytime I have a fill, I always go on a soft diet for a few days, and therefore, because of that, I'm not eating as much protein. I make a chicken and vegetable soup, but I limit my intake of other foods. So the dietitian said I need to put protein shake back into my diet around that time. So I have done that. Trying to drink my water, of course, follow the rules, protein first, not drink water for at least 30 minutes after a meal, all the things that we have learned and we hear over and over and over again. One thing that I did want to share with you, we have a local weight loss support group meeting, monthly meeting that I recently went to. Oh, let me tell you this before I say that. So now I have 4.75 cc's in my band. First time I got 3 cc's. The second time I got 1 cc. And this time he gave me 0.75 cc's. So he doesn't want to see me back for another 6 weeks. I don't know if I'll get anything I don't know if he'll do another fill when I go back. I do love my doctor because he does his own fills, and I work fairly close to his office, so if I had a problem I could go in any time. But it's just very convenient because he does his own fills, and he would see me if I'm having a problem. But he wants me to, work the band and follow my program and eat what I'm supposed to eat, and he'll see how I'm doing in 6 weeks. And to be honest, I think I have some good restriction right now. I'm staying full, and I don't think I need any more another fill right now. But let me just say this. I went to a weight loss support group meeting, and I met a lady who has a different surgeon who had her surgery 2 weeks after me. And this is particularly important for people who are thinking about lap band and are pre-lap band, or someone who's thinking about lap band. This is a question that you want to ask your surgeon, because I would never have known to ask this question. She had her surgery 2 weeks after me, and she has still not had a fill. And she's been told that she probably will not have a fill until close to Thanksgiving, because her doctor does not know how to do fills. Her doctor's a brilliant surgeon. He does gastric bypass and lap band surgeries, but he does not know how to do fills. I think he thinks that fills are beneath him, really, seriously. And he does not do fills, and he would send all his patients to, I think, a nurse practitioner for fills, or he would send them to have their fills done through fluoroscopy. And the radiologist that would do them left. So the radiologist left and the nurse practitioner both left at the same time. So now there's no one in the practice to do these fills, and they won't have anyone trained until close to Thanksgiving. So this patient and other patients in that practice can't have a fill. And needless to say, this patient's very frustrated, and she's been told by their dietitian to, they're trying to tell their patients, oh, just work the program and work the band, and it's really about learning how to eat anyway and not relying on the band. Well, let's face it. I mean, that's fine and good, but I think it's a bunch of bull. That's why they have the surgery. That's why we have the surgery. We've dieted, and I understand it is about working the program and working the band and following the diet. I understand that. But for this lady to have to go, and for these other patients to have to go almost 3 months before they can have their first fill because the physician cannot do a fill, is, I think, inexcusable. So all I can say is I love my physician, and he does his fills. So the one thing I think you should ask your doctor if you're going to have a lap band is, do you do your own fills? And if he or she does not do their fills, ask who does, and if they leave, what's your backup plan? Because these people didn't ask that, and now they are kind of, left holding the bag, and they have to wait. They can't leave and go to another surgeon. They have to wait until this practice gets someone to replace the person who left. I just found that to be very interesting, and something that I would never have asked probably, because you don't know until you have the lap band surgery. So that's just something I wanted to share with you this week. I hope everybody's having a great week. Today I did find myself eating a little bit more than usual. I found myself a little hungry. I ate a piece of chocolate that I probably shouldn't have eaten. I didn't get sick. The problem with chocolate is that it's soft and it goes down real easy, right? But I haven't had any chocolate, I don't think, since surgery. So maybe I needed it. It was dark chocolate, so I'll tell myself that was okay, right? But other than that, things are going well, and I think that for the most part, I'm really, I think that I'm following what I'm supposed to do. I'm probably a little PMS right now. So have a great week. Thank you to the new subscribers, and I'll see you soon. Okay, bye-bye.